Are you a registered nurse that's getting ready to take your NCLEX-RN exam and are overwhelmed with all the advices out there? Let me tell you something, you are not alone in this. There are a lot of myths out there that can make your NCLEX preparation even more stressful than it already is. Today, in this video, we are going to be debunking 10 myths related to the NCLEX-RN exam so you can approach your exam prep with confidence. So without wasting any time, let's dive right in. Hello registered nurses, my name is Karen. I've been a registered nurse in the US for about 6 years now, and on this channel, I've been helping registered nurses, mostly from Pakistan, get through their NCLEX-RN journey with flying colors. So in today's video, we're going to be debunking the most common myths that are been surrounding related to the NCLEX-RN exam. And I have passed my NCLEX-RN exam and I've helped multiple students pass their NCLEX-RN exam, so I know what I'm talking about. My job here on this channel is to make your journey less stressful. I understand that it is already very stressful, but my job is to make sure that I don't add, or anybody else out there don't add any more stress to your preparation. In the next few minutes, I'm going to be debunking 10 common myths. So the number one myth that we're going to talk about is the NCLEX is just like your nursing school exams. Many students believe that NCLEX-RN exam is the same kind of exam that you are used to taking in your nursing school, or it has the same information that you studied in nursing school. While a part of this information is true, NCLEX does test your knowledge and does test you on whatever you've learned in your nursing school, but it is a very different exam that you're used to taking in your nursing school. As I mentioned in my last video, the NCLEX-RN exam uses a system called computerized adaptive testing. How this works is, if you're doing good, the questions are going to get harder and harder, but if you're not doing good, it's going to start getting easier for you. It is designed to assess whether you have the minimum competency needed to be a safe and an effective nurse. So it is not about memorizing all the information that you've learned in your nursing school. It is about understanding what to know in real life situations. Myth number 2 is you need to know everything for the NCLEX-RN exam. I have also made a detailed video on this topic. And let me tell you, this myth can cause a lot of unnecessary anxiety. Trust me, you don't need to know everything at all. The NCLEX exam does cover a broad range of topics, but it is not important for you to memorize each and everything that you've learned in nursing school. Instead, you just have to focus on understanding the concept and applying that knowledge in real-world situations. NCLEX is designed to evaluate your critical thinking skills and your decision-making ability. You are more likely to be asked questions that assesses how you would respond in a certain scenario. So there are 3 most common things that you need to focus on. Number 1 is fundamental nursing principles. Number 2 is clinical reasoning. And number 3, and the most important thing, is patient safety. The third most common myth is that you should not start practice questions too early. This is a huge myth, and let me tell you, NCLEX prep questions are very, very important. It is one of the most essential steps of you passing your NCLEX-RN exam. These questions are actually going to prepare you on how you're going to respond to questions in your NCLEX-RN exam. Taking practice tests early helps you identify your strengths and your weaknesses. It is an excellent way to get familiarized with NCLEX-style questions and the format of the NCLEX-RN exam. Plus, they will help you be more comfortable with the time constraints that you're going to have on the test day. Don't worry at all if you don't do good in your first couple of practice tests. Use these as your learning tool to improve your work areas. The more practice you get, the more confident you're going to feel. Myth number 4 is the NCLEX is only about memorizing facts. If you're just memorizing the facts, you're missing the main point of the NCLEX-RN exam. While knowledge is very important for this test, but the main goal of this test is how you apply that knowledge into practice. It's about critical thinking, prioritization, and understanding nursing interventions based on clinical scenarios. For example, you may be asked to prioritize patient care or decide the best course of action in a life-threatening situation. So instead of cramming facts, work on strengthening your problem-solving skills and your clinical judgment. Myth number 5. I've been hearing this a lot from different people. Myth number 5 is you have to get every question right. Let me tell you once again, this is totally wrong. You do not have to get every question right in your NCLEX-RN exam. This is a very big myth, as this causes a lot of stress, even when you're doing practice questions. But I'm here to put your mind at ease. On the NCLEX-RN exam, you do not have to get every question right. The computer adaptive testing system evaluates your ability to answer questions correctly at various levels of difficulties. You can miss some questions and still pass if you're answering enough questions with high level of difficulty. So don't stress about getting every question right. Instead, focus on doing your best and thinking critically for each question. Your goal is to demonstrate that you're a safe nurse, and it is not perfection at all. Myth number 6 is that you have to answer all 145 questions in your NCLEX-RN exam. This is a big misconception that leaves a lot of students stressed out. Actually, the NCLEX-RN exam is designed to stop as soon as it determines that you are a competent and a safe nurse. You may stop well before reaching 145 questions. The first time it assesses you is at 85 questions, and if it determines that there is still some room for improvement, it keeps giving you more and more questions so that it can have a better picture if you're a safe nurse or not. And after 85 questions, it keeps assessing you, and it's not necessary that it's going to take you up to 145 questions. If the computer determines before 145 questions and after 85 questions that you are a safe nurse, the computer would stop and you are going to be deemed pass in that test. So don't focus on answering 145 questions. Instead, focus on doing the best as per your ability. Myth number 7 is you need to study 24/7 to pass your NCLEX-RN exam. This is definitely a myth that can lead to burnouts and anxiety. While it is very important to study consistently, it is not at all important to study 24/7. In fact, taking breaks and allowing your brain to rest is essential for retention and focus. Quality over quantity is the key here. Study efficiently and stick to a study plan that works for you. Remember, your brain needs a lot of time to process all the new information you're feeding it. So don't forget to rest and recharge. Myth number 8 is that the NCLEX-RN exam is all multiple choice questions. This is a big misconception that can surprise a lot of students when they're taking their exam. The NCLEX-RN exam include multiple choice questions, but it also features a lot of other formats like multiple response, hotspots, true or false, or fill in the blanks. These type of questions test your ability to think critically and apply this knowledge in the real-world scenarios. So make sure you familiarize yourself with all the different format NCLEX-RN includes so that you are not surprised on the test day. Myth number 9 is that you will fail if you do not pass the first time. This is one of the most damaging myths, as it can add additional pressure to the test taker. Many people don't pass their NCLEX-RN exam on their first try, and that is perfectly okay. The important thing is that you learn from the experience, adjust your study plan, and try again. you can take another attempt in the next 45 days if you fail your NCLEX-RN exam in your first attempt. The NCLEX is a very challenging exam, and multiple attempts are not uncommon. So remember, failure does not define you. It's all a part of a learning process. Remember that you can always pass your NCLEX-RN exam in your next try if for some reason you failed for the first time. The next most common myth is that you should only use one study resource for your preparation. While it is very important to have just one go-to resource, relying on just one study guide can limit your preparation. The NCLEX-RN exam covers a wide range of topics, and using different resources can help you with your approach to different scenarios. It's also helpful to use practice questions from different resources to get familiar with different questions and different formats of the NCLEX-RN exam. So don't be afraid to mix it up at all. Combining different study resources and mixing it all up can give you a good, well-rounded experience of your prep and can also boost your confidence. So there you have it. Top 10 common NCLEX-RN myths debunked right here in this video. Don't let myths and misconceptions push you away from your preparation and your end goals. Focus on smart studying, practice, staying calm, and staying confident. Let me tell you, you got this. Thank you for taking the time out to watch this video, and thank you for supporting this channel. Don't forget to like and subscribe to the channel. And if you have any questions or if there are any topics that you want me to make a video on, don't forget to leave it in the comments below, and I will try my best to get to that as soon as I can. And once again, good luck on your NCLEX-RN prep, and I'll see you in the next video. Thank you.